Are you interested in understanding GLP-1 medications like Ozempic, Wegovy, or Mounjaro? Then join us on The Plus Sides, Cracking the Obesity Code, the groundbreaking podcast helping people change their lives one episode at a time. The Plus Sides podcast is a disruptor. We're breaking down barriers, smashing stereotypes, and sharing inspiring stories that'll leave you feeling informed and empowered. Join us every week to learn from doctors who are specialists around GLP-1 medications like Ozempic, Wegovy, or Mounjaro. They'll provide you with science and facts to validate these incredible stories. But that's not all. We'll also bring you the voices of the GLP-1 Mounjaro TikTok community, real people who face the challenges of obesity-related diseases and disorders and discovered the incredible plus sides of GLP-1 medications. Our episodes are filled with heartwarming stories, laughter, and moments of triumph. You'll connect with our amazing community members who are reclaiming their health and experiencing their fullest lives. Are you ready to embark on a journey of discovery and empowerment? Tune in to The Plus Sides, Cracking the Obesity Code, and together we'll change the narrative around obesity and end the stigma. Subscribe now on YouTube or your favorite podcast platform and join our incredible community. Let's celebrate the plus sides of life together because every story deserves to be heard. Every life deserves to shine, and everyone deserves access to expert knowledge and medication. The Plus Sides Podcast. You're not alone. It's welcome to the Plus Sides Podcast. Well, tonight, ladies, we're going to be talking about something that is a big thing that I feel like we always hear in lives. And that for sure it's something that like even I have questions about. It's people who have had one of different kinds of bariatric surgery, and who eventually gained their weight back or weren't able to get rid of the food noise, whatever it may be, and needed additional help and have started GLP-1s or want to. Or for people who maybe need to have bariatric surgery but want to start on a GLP-1, either because they want to see if they can lose all the weight that way, or they want to get themselves to a healthier place for the surgery to be more successful. So I think there's a home for it. And we're going to have on a doctor who is a professional and will help with that. But before we do that, we're going to have a story that aligns with what I'm trying to answer, because that's how we roll here. Hey, that's how we do it. So without further ado, I would like to introduce Brandy to tell her community story.
Yay. And may we also, I want to give a special shout out for the pumpkin spice latte hair color.
Oh my God, the hair. But no, what are you calling it again? Cowboy. What is it called, Brandy?
Yeah. What is it? Cowboy copper.
Cowboy copper.
Cowboy copper.
That's not gonna lie. I'd really next event, I'm gonna need to do my hair just like that on accident, just like that. It's so good.
We can hold up in a hotel room. Your hair is light enough that I'll just be able to do a deposit only.
It's only light in the front.
Oh, but it's still light.
That's my pop. Stop. Anyway, kidding. Hey, we're so glad to have you here.
I'm glad to be here.
Something that I know you know, but something we like to do here that's important is when we started the show, you know, I myself, the girls, many people in the community were very much tired of people taking our stories and testimonials of these life-changing experiences and diminishing them by giving them 30 seconds on television, you know, and blocking out our tummies and just things to fit their agenda, you know, and it was hurtful, you know, not to mention calling us all the things in the land, including cheaters and all that stuff. And I just got sick of it. So, you know, we started this. And so it's important for our guests to be able to tell their story unfiltered and uncut and newly added, uninterrupted.
Yeah. We get excited.
We get really excited.
I just have the facial expressions.
Yeah. She just waits for it's a Virgo's watch, right?
Yeah.
They just sort of like watch and she waits to see what's going to happen before she like jumps in, you know? Anyway. It's not Virgo season anymore. It's Libra season. That's right. But you know, when this airs, it's going to be Scorpio season.
Yeah. That's me.
That's right. I love it.
Right now, it's
all
big
right.
energy.
What about you, Brandy? What are you? You Scorpio?
Yeah. Yeah.
Yay!
I turned 45 on November 7th.
Oh, 44 November 20th. Got you. See, I knew we were sisters from another mister. That's why a year apart, clearly.
Yeah.
Anyway, hey, Brandy, how you doing? Brandy's my friend.
I'm good.
So we would love for you to be able to take the space and tell your story, unfiltered and uncut and uninterrupted.
Okay, can I make a shameless plug for my shirt?
Always. Let's do it real quick. Yeah.
Okay.
Let's see.
So
Let's
this
see.
is my new shirt from Carolina with the Reverie Boutique. I love her stuff. We can be loud and proud about being GLP-1 baddies or PCOS baddies. Like,
Yeah.
you can check out her link and my stuff, but support her.
Great.
Yeah. Anyway, says Glutide Gang.
I love it.
Thank you guys for having me on the podcast. I'm super excited to be sharing my story with everybody today. I want to be loud and proud, and I hope that whoever is watching this and listening to this maybe resonates with my story, and it will give them some courage because maybe they're afraid like I was. But anyways, I live in big, beautiful Wyoming, and in my late teens, I got married pretty early, started having some babies, and the weight just started creeping on after having babies. I started noticing that the thought of food just constantly was in my head. Wanted to sit and eat carby, sugary, chocolatey, like all of the things, right? Get up in the middle of the night, have snacks. Some traumatic events happened in my life. Ended up having a divorce, and pretty soon I'm nearly 300 pounds. And I have a binge eating disorder. I learned just recently. I did not know that that was a thing. I didn't know you could have binge eating disorder and it not be a purge thing as well. So if I'm being gross, I'm sorry. I'm not trying to be.
All right, I'm going to interrupt you. And then I swear I'm going to shut up. We talk about all that here. Kat and I both have one. It's cool.
Okay.
Safe place.
Okay. Yeah. Okay. So with that, I didn't know what binge eating really was. I just knew that I ate a tremendous amount of food all the time. And at one point I started looking into weight loss surgery, and of course the insurance did not cover it, but pretty soon in the future I had a job where it did. But then I started looking into it, and it was, you had to do this for 6 months, and then you had to do this for 3 months, and then you had to prove this. And I had to prove myself to someone sitting behind a computer saying, nope, I don't think she qualifies, decline, deny. And I'm like, no, you don't know me. You don't know anything about me. You're not sitting inside of me, right? So I started looking at weight loss surgery in Mexico. And I was alone. I didn't have anybody. I mean, I had my kids, but I wasn't living. I was eating so much food that I was maxing out credit cards. I was using credit cards to go out and just get as much food at different locations as I possibly could. They knew me by name in most of the drive-thrus in this town. They knew what kind of sauces I wanted. They knew what kind of drinks I wanted. I could just pull up and they knew it was me by the sound of my voice. And they're like, hey, Brandy, are you going to get the number blah, 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 blah today? Mm-hmm. Yep. And please, that's how, it wasn't just a Starbucks order. It was, I'd wake up in the morning. What am I going to have for breakfast? Oh, okay. It's going to be McDonald's. And then while I'm in the McDonald's drive-thru, it'd be like, okay, do I have, what am I going to get for lunch? And it was just incessant, constantly. I was obsessed about food. And then, like I said, I was looking into surgery in Mexico. And I don't know if any of you are familiar with Facebook Marketplace, but I put like a classified ad on there in my local area. And I was like, is there anybody in this town that has gone to Mexico and had weight loss surgery? It was embarrassing. It was weird, but I was like, who cares? Like, I'm already, I'm past the point of caring anymore. And I was flooded. I mean, flooded with people in my very own community that had gone to Mexico. And a lot of them had gone to the same surgeon. Pretty soon I get this private message from this woman. She's a business owner here in town. And she's like, I want to talk to you. And I thought, oh God, this woman is going to be like, don't go do that, And she's like, here's my number. Please call me. Please, please, please call me. So I call her and she's like, I need to talk to you. She's like, I just had this overwhelming urge to speak to you. I'm like, okay. And she's like, this is the doctor you need to go to. I'm almost 6 months out from him. This is how I'm doing. There's 6 of us here in town that have gone. I can still, to this day, message that doctor and he will message me back post-surgery. And I'm 4 years out. And she's like, you have to go see him. And she goes, and not to mention, he's pretty easy on the eyes. And I was like, sold, he's hot, let's do it, right? That means he's qualified. Definitely. If he's a hot doctor, I mean, sign me up.
Mm-hmm.
But no, her and I became friends. And that was, I believe, I can't quite remember when that was, 2018. No, 2019. I'm so sorry. And I started the process of filling out his paperwork. And one day I'm sitting at work and my cell phone rings in this really bizarre like video call. I think it came from Google. And I answer it because I'm not one of those people that'd be like, no, decline, don't know the number. I'm like, who calling? Like, who? People call people? But anyways, and it's him. And I was like, who are you? I didn't set an appointment. I didn't he was just like, hey, you filled out the application. You know, I just wanted to call you and see if you have any questions. And I'm like, lots of questions. And he's like, well, shoot, tell me. And so we talked for about 30 minutes and he goes, you just let me know. You just let me know when you want in. I've got you. Found out I had a thyroid condition, probably part of my reasoning. Because he required me to get blood work. He required me to be healthy enough to do the surgery. I obviously was not healthy. My A1C was pre-diabetic. I had sleep apnea. I was nearly 300 pounds. I had a thyroid condition that I did not know that I had. Mind you, I'd had multiple panels of blood work drawn that a thyroid panel was in there, but not one time did the doctor say. And I sent him the work and he goes, you need medication for your thyroid. We have to get your thyroid under control before we can do the medication. So I called my doctor here in the States and he's like, well, your thyroid's fine unless you're having symptoms. I'm like, what are symptoms? And he's like, well, you'd be really very, very tired all the time. And I'm like, yeah, I'm all of those. And I'm fat.
Like, duh.
Yeah. I was just like, okay. So one thing that I did start learning, and if people don't know this is something that I always tell anybody that is of childbearing age when they are getting ready to go have weight loss surgery. You will become fertile myrtle. You can very easily get pregnant after you have lost all of this weight. So I was like, well, I'm single and I'm going to be skinny soon. So, you know. So I went to that doctor and I was like, hey, will you still see me? Because that is also the other issue. When you go to Mexico, providers will no longer see you sometimes. They're like, you went to Mexico, you're on your own, right? And he's like, yeah, I'll still see you, but I caution you on this and I caution you on that. And I said, here's something that I need. And I'm just going to be real and honest with you because that's the story of the podcast here. I was not living. I, honest to God, was preparing myself to control, alt, delete, and exit the game of life. Like that was literally where I was at. So I told him, I said, I really don't care. This is my option to live. I'm not living. I'm eating myself to death. I'm in debt because I'm eating myself to death. I hate everything about myself. I don't even know who I am anymore. I someday want to have a relationship. I don't feel like that I can do that because I'm not ready. I want to be healthy in my mind, healthy in my body, and healthy in my heart. And so this is my first step, is healthy in my body. So I can do all of those other things. And he just looked at me and he goes, well, it sounds like you've done a lot of soul searching and a lot of research. And I'm very proud of you because not everybody does that. And I'm like, nobody's going to do anything for me. I have to do that on my own. So will you still see me? He's like, I'll absolutely still see you. And I found a primary care provider. And in August, I flew to San Diego. I was picked up. I had gastric sleeve surgery. And in 8 months, I'd lost 100 pounds. By year 1, I'd lost 120 pounds. I was doing great. I was textbook gastric sleeve surgery, literally. I wasn't having any vitamin issues. My blood panels were phenomenal. Like I was thriving. And by year 2.5, I was struggling with a lot of stuff. Drinking, what they call transfer addiction, I guess, because I wasn't really binge eating yet. I was drinking because, you can do that. You can drink a lot more than you can eat. I quickly learned how I could binge eat even with restriction. It did not take me very long. So by year 3, I had gained 20 pounds. And for most people, they would think, oh, 20 pounds is not that much. It's pretty easy to lose, just get back on the horse. 20 pounds to me was devastating. 20 pounds to me was like I had completely failed. Scrolling through TikTok, one day I come across several TikToks talking about Mounjaro and Ozempic and GLP-1 medication. And I heard for the first time the term food noise. And was like, and this woman just starts talking about it where she was incessant and she had to eat and she had to have certain foods. It wasn't always just like eating, it had to be certain foods because that certain food is what, and people talk all the time, oh, just take it out of your house. Then you won't have the temptation. I'm going to get in my car at midnight and go find it. Like, that doesn't work. Like, this brain is like, no, you have to have it. I won't sleep until I get it. Period. So that was August of last year. In 9 weeks, I lost the 20 pounds with Mounjaro, which was like very quick. I didn't get over 7.5.
Wow.
So that was pretty, and then I was like, oh, okay, I lost that 20 pounds. And then I was like, oh, but I could lose more. Like if I lost more, then I would be in not the overweight, because I was still considered overweight, even at the 120 pounds that I had lost, right? Weight loss surgery. So 10 more pounds, I'll be what's considered at a healthy weight. I won't be overweight. I won't ever look at obese. So I did 10 more pounds. But with that, I also had other struggles that creeped in. Very unhealthy thought processes about my weight, very unhealthy thought processes about, I don't want to say abuse. I think abuse is a very negative, but of letting Mounjaro take over my head, right? Because if Mounjaro was in charge, Brandy wasn't, and she wouldn't make mistakes, right? Mounjaro would do it for me, and I let that happen because I wasn't thinking about food. I wasn't eating. And I think that's that unhealed portion of my brain, I guess we would say, and I don't want to speak negatively on the medication because it is very much was a life-changing thing for me, and I'm grateful for it, and I thank God for it every single day. But I also know that I do have a disordered brain in there, and when it's scary, like it is when you have a binge eating disorder and then you have something that is taking care of it for you, you're just like, okay, it's kind of like giving it to God, but you're giving it to the GLP-1 medication. And so I had to do a lot with that. The coupon expired and we got new insurance, and they're like, nah, girl, you can't have Mounjaro. And so I panicked, but they said, but guess what? We'll give you Ozempic. And so I was like, okay. I knew Triplet Dad had lost an insane amount of weight. And I wasn't looking to lose any more weight. I was looking to just continue to control that monster in my brain. And so I started taking Ozempic. And at first that was so scary because the first time my stomach growled, I lost it. I was like, oh my God, this isn't going to work. My stomach just growled. And to me, that was like, the medicine isn't working. I instantaneously, cause I'm kind of weird like that, but, through talking with people and they're like, girl, cause you're hungry. Like it's been 4.5 hours and you eat this much food. You're hungry. Eat some food, sis. Eat some food. You know what to do. And that's kind of like what I had to remember. And if you go through my TikToks when I first switched from Mounjaro to Ozempic, there was so much emotion there because I just thought I was failing again. Because I gained 6 pounds, but I also went back to Mexico and had a lift in implants. And my boyfriend finally looks at me and goes, how much do you think them implants weigh? And I was like, oh, good point. He's like, let me see. You know? He's like, I bet it's 6 pounds, babe. I bet it's 6 pounds. Oh, if I cannot tell you how this man has saved my life. But anyways, that one was a good one, right? I was like, yeah, it's probably 6 pounds. But but I
solid
was like,
6 for sure. It's definitely
yeah.
that.
I mean, there's silicone.
It was really, really hard not to interrupt you on that one because that was hilarious. You're so funny. It's so hard not to.
They're double D's. That I'll tell you what, they're double D's. They got to, because I was thinking about like when I was almost 300 pounds, like you pick those things up because you had to put them in the over the shoulder boulder holder. I know. I'm sorry. Sometimes I have no clue, but I'm just saying. You ever watch Beaches? That's where I get that over the shoulder boulder holder.
Yeah.
But
Sure, everybody's seen Beaches. It's like
yeah, you should. If you haven't, you should.
movie.
Yeah.
Period. That's what you watch.
Yeah. But so I also did that for myself, you know. So, but Ozempic is great, and so it works great for me. And my insurance, the blessing to that is I once did have a high A1C, and my insurance was like, hey, you know, my doctor was like, we got to keep you at a healthy weight, obviously, because, and my mom is adopted. My biological father is not in my life. I don't know a ton about my medical history. And this doctor was like, yes, girl, like we need to. And so she felt comfortable saying, this is what we need to do. And they pay for it. So I'm grateful because not everybody has that. And so I had to rein myself in with the craziness of the Ozempic because it wasn't the same for me with Mounjaro. But I will tell you, Ozempic calms my brain enough, but I can still be normal and eat properly for me. I'm not saying, oh, I never eat. Like, that's ridiculous. Those things are stupid. And it makes me angry that people say that. I eat differently. I'm able to make better choices. I'm able to make choices that are, I guess, maybe not always what one would think is the food, but I can eat something and not be like, I need 3 cheeseburgers, a large fry, and a huge Coke. I can have a cheeseburger and I'm done. Awesome. And I'm normal.
Yeah.
You know?
Yeah.
Whatever that is.
Yeah, right.
But,
I don't know either.
Yeah. So that's a compressed version of it. Yeah. But I will tell you something that I didn't know, because we talked about this in the Oprah podcast. Mm-hmm. I never looked at my obesity as not my fault. I always looked at it as mine because of the amount of calories that I consumed, because I did sit down and I calculated how many calories in just a normal day, and it was nearly 6,000 calories without binge eating. That was just eating food. That's a lot. So I never looked at it as this was just me overeating. So all of my friends that have that work out constantly, and I was not. So I felt my obesity was me.
Sure.
But there still is that not everybody eats that way. So there is something wrong. It's not just that the choices that I was making, it's the insanity that was going on inside my head all of the time. The person that I was extremely consumed by food. Also, what I didn't know that I learned is a lot of this is set on by trauma. And if you knew the trauma that a lot of us have endured, but the things that really set in motion the binge eating, I was like, okay, that makes sense.
Yep.
Because why? Why did I start doing that? What? Because I didn't always do that.
Yep.
So
yeah,
I've learned a lot.
Yeah.
Learned a lot.
I think we learn a lot from each other. Do you know what I mean?
Yeah.
Like in our community, I think it was really hard for me not to get emotional during your story because like I relate with so much that's in it. And, you know, I can see as your friend, when you talk about things, you're not always at a place of forgiveness, it seems like, of yourself. And it's not easy. And it's honestly, when you were describing like giving it to God, like the whole idea of giving it to God and giving it to the medicine, like that same letting go, right?
Right.
The thing is with my experience with binge eating disorder, and also, by the way, props to YouTube. If you talk about binge eating disorder, they actually promote your content.
Wow.
Mm-hmm. Oh yeah. It's a new policy. Isn't that fabulous?
Good.
We're going to talk about it. Yeah.
They need to.
Yeah.
Hallelujah.
Because can't do it other places, you know, but,
I felt so alone.
So real. Like
of course you did. It's so real. Yes.
And I haven't done this yet, but I owe my mom an apology because I didn't understand it as younger, like why she would sit up at night and we couldn't have these things, but she could, right?
Yeah.
I get that now.
Yeah.
I get that now. And the whole, it is genetic, and where, like, one thing that I did learn and that I want people to know, I did end up being able to meet my biological grandmother, my mom's mom,
Nice.
obese, had a severe drinking problem. So much so that you could see the jaundice in her eyes. It was so sad. But I was young, so I didn't understand. Now, looking back in that meeting, I'm just like, oh my God.
Yeah.
Oh my God.
Yeah. The aha moments are everywhere.
Yes.
And like, I remember the first moment, and I talk about it on the show a lot. I remember when the emotional connection to food and how I cope was severed, just like a cord, just like that. And I did not know what to do with myself, Brandy.
Right.
What do you mean I can't eat food? What do you mean I don't want food? I don't want food. What do you mean I don't want food? Like, what do I do then? I remember being like, how do I don't like, and the panic and then going through that emotional piece and being like, holy shit.
Well, nothing works.
It wasn't my fault. Right?
Right.
Like if you can take a medicine and I when I first started explaining, I was like, I don't know, a hormone that makes your gut right. I was like oversimplifying. And I was like, and then it stops. Then it wasn't. Like it wasn't. And I remember all of the times that I would go on a diet, which was about every 3 to 6 months, my entire life, right? But it would come back. So when we had Dr. Rosen on the show, who's a bariatric surgeon and also treats with GLP-1s, he was on the show and he was like, but it was your brain, right? Like no matter what, whether you had surgery or not, your brain, because you have obesity, was going to try to trick you into like, that's what it is, right? It's trying to trick you, feel like you have to have it, right? Because it thinks you do. It thinks you do. So when you fix the thing, right, then this gets fixed and it comes down to the brain. So the amount I feel like of healing, but like Kat and I can for sure, like we have had trauma, and there is something that happens with that. Yeah.
Food is a mind-altering substance.
Yes, it is. It's an
Yes.
addictive substance.
Well, and for me, Monjaro took away my want to drink, and
Yeah.
it took away my want to smoke. So like all three of my vices, food, drinking, and smoking, were like poof. And it wasn't until
probably all obesity. Like it was probably all obesity. You know,
well, I'm just going,
Yeah.
what do I do? Where do I go?
What do I do?
What do I focus on now? Because I've got nothing, and I was so
So
sad.
much
And I
life to
saw
live now.
right, I can go live my life
Yeah.
because like my boyfriend. It was so funny when we first got together. He's like, "Do you want to go fishing?" And I was like, "How long are we going to be there?" Because I need to know how many snacks to pack. I need to know. Oh, part of that, you know what I mean? And he's like, "Well, we can eat breakfast and then we'll probably be." And I'm like, "No.
Yeah.
Nope. I have to have a snack because I will guarantee you in 35 minutes I'm going to want to eat something."
Yes.
And so we had a cooler everywhere we went. That poor man was like, "What snacks would you like me to bring you?"
Yeah.
Now it's like, just you, babe. Just you. You're the only snack I need.
I did love when you were telling your story and about when you mentioned about gaining the 20 pounds and how you were like, that equaled failure to you. And I get that. I had that same thing happen. So, you know me, like I had lap band in 2007. God, that's crazy to say that. I lost a lot of weight. I kept it off a long time. I had a couple miscarriages, eventually had my son. And I don't regret it. I don't regret the surgery. It got me to a place where I could be a mother. And I love being a mother, you know, but I wish I had known these medicines existed, or that some doctor would have said that, or some doctor would have checked my hormones or something, because one, I'd probably have more kids. Right. And two, maybe when I gained that 20 pounds, like I wish I had been as brave as you were and said, "Hey, like I gained this," but instead I shamed myself. I started to binge eat again. I told all the negative self-talk, like you said, like negative self-talk, abuse, like that's what you're doing to yourself, right? I remember when that happened. I remember thinking to myself, like legitimately that I was a lazy piece of crap and that I was pathetic. And I would constantly tell myself that, because how could you possibly binge eat when you have a lap band? How pathetic are you that you are drinking? This is what I used to think to myself, that you are drinking water and eating cereal and whatever it is because you feel like you have to fill yourself up constantly, right? And at the end of the day, it was because I have obesity and it is a chronic disease, you know? But nobody ever told me that, not even when I got my lap band. Nobody said that. It was "Hey, you're pretty young." I was 27. They're like, "Hey, you're pretty young. Like we can always take it out," kind of thing, you know? But I do think like you, like actually the combination of the two is very good for me. I don't feel like I need to have my lap band out. I have no problems with it. I think that plus GLP-1 is a really good thing for me, you know? So
Right.
I can relate with so much of that. And I get so many questions, and I know Journey does too, in lives from people who have had surgery. And then I think sometimes there's people, right? Like we know, like Triple Dad, right? Who's been on the show, where he is now at the path where he's like, the amount that I need to lose, I'll probably have to do surgery to get there, but he's doing as much as he can on GLP-1s, right? And then there's other people, I think, who, you know, are like us, right? Like they had the surgery, they didn't get all the way there and they need help to get all the way there, or they gained it back and they need more help, you know? So I think it's sick people that need medicine. And I'm tired of people talking about it as anything but that. Sick people need medicine. And if we know that this is a chronic medical condition that reoccurs because chronic, you know, and we recognize that it is a disease and we have FDA approved medications to take it, what the fuck are we doing? Like, why are we shaming people? It's absolutely insane. There's no other disease that we would say this about. Anything. Nothing. There's nothing. We had Dr. Toomer on our show, and she said that fat shaming or fat bias is the last discrimination that we tolerate. It's the last one we tolerate.
Yep.
So
what is CVS Caremark doing? They're causing more disordered eating because they want to monitor what you're eating. Are you exercising?
Yes.
In order to give you
that, right? Yeah. Let's put you through traumatic diet culture, right? That you already went through the majority of your life because everybody told you it was your freaking fault. Like, let's do that again. There's nothing like re-traumatizing you in healthcare. Like, Sorry.
Yeah.
Hallelujah.
No,
Hallelujah. We're
it's
GLP-1 evangelist here.
it's true though,
Yeah.
because even just today there
Yeah.
was a new member of the community who said her doctor, she went to her doctor and she said something's not right.
Yeah.
And especially as women, but we as humans, we can feel when something's not right
Yeah.
within us. And her
Right.
doctor told her, "Well, why don't you just go to Weight Watchers?"
Yeah.
And he dismissed her.
Exactly. Of course. Happens all the time.
And
So
that's what he said to her. And she came like
Yeah.
in
I know.
tears. And
I
my
bet.
heart just dropped.
Of course it did.
Look at Brandy.
Yeah.
She's like, I
Speaking
can't
of
hold
all
it
of these
together.
things and
We
clinical
have a great
stuff and all
doctor.
the things, we have a great doctor with us today that
That
happens to
believes in this
understand
stuff.
where we are coming from. I'm going to invite him in. Well, hello. This is Dr. Kais Rona. I will
Dr.
not going to
There.
say
Rona.
that's right. We're so glad to have you with us. Thank you so
It's
much for coming here.
it's an
Can you
honor.
hear me okay? Okay.
I thank Brandy for that story. I think you were so raw with your emotions, and I think it's so important for people who've struggled like you did to hear that. And I think what you guys are doing is absolutely amazing. So keep going, and it's an honor to be here.
Thank you. We're so glad to have you be a part of it. So thank you. So for people that don't know you and watch your TikToks like I do, can you tell us a little about who you are and how you help people?
So my name is Kais Rona. I'm a bariatric surgeon, so I specialize in weight loss surgery. I grew up here in Southern California. My practice is in Orange County, and essentially I help patients who struggled like you guys did with obesity all their lives, and was told by doctors to diet and exercise, and that it's under their control and they can fix this problem. And I help them, with managing their chronic disease. It's exactly what you described. It's a chronic relapsing disease, and now it's amazing that we're finally able to accept that. And I think as we're able to accept it, we're able to provide better treatment for patients to address this. And it's a complex condition, and it's very, very difficult to treat. Being a practitioner who manages obesity is definitely not easy, and it's much harder on my patients than it is on me. But I see and I struggle with them through the process. So it's a very gratifying position for me. I love my job. I love to be in the operating room and do surgery, but I also love to develop relationships with my patients. And with weight loss surgery, the nice part is that you really become like family. So I see my patients, as you guys know, on a yearly basis, because with weight loss surgery you do have to monitor things like vitamin levels. So my patients, like you mentioned with your doc in Mexico, my patients text me, they'll send me pictures of their updates years later, and it's great. So I'm very happy to be doing what I'm doing, and I'm honored to be able to help patients who have been struggling with obesity.
That's awesome. I'm curious, like when you were in school and you were like, I think I'll be a doctor. And then you decided to choose a specialty. Like, why did you choose obesity? Why did you choose, like, in terms of being a surgeon? Why were you like, this is the kind that I want to do? What was that driving force?
Yeah, that's an interesting question. And honestly, it never even crossed my mind. When you're in residency, you get exposed to all kinds of different operations. So you do pediatric surgery, trauma surgery, oncologic surgery, which is cancer surgery. And so one of those rotations is bariatric surgery. And I was always kind of I gravitated towards laparoscopic and robotic surgery, which is minimally invasive surgery. I'm really good at it. And one of the most complex operations that's done laparoscopically is the gastric bypass. So it's a very challenging operation, but also a very gratifying operation. So naturally, I chose bariatric surgery as my route. And as I did more bariatric surgery and got to learn a little bit more about it, I understood, the importance of the education and the counseling and building relationships with your patients. That's what really kind of drew me in what was really great for me. So that's how I ended up in the field. And I'm really glad I chose that field, just because, like I said, you develop these invaluable relationships.
Yeah, that's awesome.
That's very awesome. Okay. I'm going to build on. Well, I'm going to ask the question now. Could you describe for us some of the varied types of bariatric surgeries there are and what the procedures entail? And also if there are any procedures that may or may not be covered by insurance, like if there's new ones coming out and things of that nature.
Sure. So when you think of bariatric surgery in general, I like to categorize it in terms of restrictive and malabsorptive operations. So restrictive operations are operations that decrease the size of your stomach. So the most common one is the sleeve gastrectomy. And the sleeve is the most common weight loss operation that's done in the US. Before it used to be the lap band. Now the lap band has decreased in terms of volume. It's kind of gone out of favor, and the sleeve is the more more desired operation by patients, and patients tend to have better outcomes with it. So in the sleeve, essentially what we do is we decrease the size of the stomach by 80%. So typically a normal stomach is about the size of a soccer ball or a ball, and can fit 2 liters of food and fluid. We remove or excise 80% of the stomach, turning it into a banana. So a significant portion of the stomach gets removed, and that causes hormonal changes that help induce weight loss, but also causes what's called restriction. So you eat a small amount of food and you feel full. The other category is called malabsorptive procedures. These are a little more complex, and an example of a malabsorptive procedure is the gastric bypass. So the gastric bypass, essentially what we're doing is rerouting the intestines. And the reason we do that is to decrease absorption of food and nutrients. So with the gastric bypass, not only do you shrink the size of the stomach, you make it even smaller than it is in the sleeve. So you make it about the size of an egg, so about two ounces, but you also reroute the intestines. And by doing that, you decrease absorption of food and nutrients, and patients are able to lose weight through that route, as well as the hormonal changes and the restriction. And then so those are the two broad categories. There's a less common malabsorptive procedure that's called a duodenal switch, or sometimes called a SADI. This is the most effective weight loss option. It's not done as commonly as the bypass and the sleeve, and that, like the bypass, causes malabsorption. But because you connect the intestines in a more distal or a further part, you have more malabsorption, so hence more weight loss. In terms of new procedures, one of the newest procedures is an incisionless procedure called an ESG. It's called an endoscopic sleeve gastroplasty. So it's kind of marketed as an incisionless sleeve. So it's done endoscopically through the mouth. So a gastroscope or a tube with a camera at the tip is inserted into the stomach, and the stomach is created into a tubular shape. So just like a sleeve, but nothing is resected or removed. So essentially, you're just shrinking the size of the stomach from the inside. And that procedure has been done for many years now. In terms of long-term outcomes, because it's a newer procedure, we don't have good data on the long-term outcomes. But in general, it seems like it's about half as good as a sleeve. So in terms of weight loss, a sleeve usually leads to about 20 to 30% total body weight loss. So if a patient weighs, let's say, this is just to make it easier, 100 pounds, they should expect to lose 20 to 30 pounds. With the gastric bypass, because we're not only shrinking the size of the stomach, we're also rerouting the intestines, you get more weight loss. So typically with the bypass, patients can experience anywhere between 30 to 35% total body weight loss. And with an ESG, the newer studies are showing that it's about half as good as the sleeve. So you usually get around 15, 16% total body weight loss, sometimes can be up to 20%.
Wow.
And in terms about insurance coverage, so the ESG at this time is not covered by insurance, so most patients pay out of pocket. The sleeve and the gastric bypass are covered by insurance, but as Brandy alluded to, it's a pain in the covered sometimes, and it's such a struggle as a surgeon and physician to get these operations covered. And sometimes we have to do what's called a prior authorization. We get on the phone with the, we have to plead our case. Like this patient, has a BMI of 37. They have diabetes. They have high blood pressure. And so you have to kind of plead your case to get it approved a lot of times. And the interesting part, because I was listening to Brandy talking about how, it's so hard to be denied, by insurance companies when clearly that you would benefit from this. And the interesting part is that the insurance criteria that we have currently is from 1993. So it's completely outdated. Patients with a much lower BMI, BMI of 30 and above, actually benefit significantly from weight loss surgery. But you know, it take a lot of time and in conversations like this for them to catch up and really, you know, be able to provide patients the care that they need.
Wow. I'm gonna be a little
Yeah.
speechless. Oh, 1993.
I know.
Wow.
Yeah, I mean, so outdated. They're just dinosaurs.
Wow.
Yeah. Yeah.
Just
That's
dinosaurs.
interesting. Yes, you have a question, Brandy?
I do. Have you or are they looking in the States about Botox in the stomach instead of to lose weight? Have you, I know it's a new thing they're doing in Turkey. Have you heard anything about that, Dr. Rona?
Yeah. So it's not necessarily a new thing. It's been done previously. You know, there is no good scientific studies that really shows that it's as effective as a weight loss surgery. Patients respond differently to it, and it's not a procedure that's really recommended at this time. I don't think we have good enough information to really support it. And I have very strong suspicion about that procedure. And I don't think that it's nearly as effective as weight loss surgery. You know, the nice part is that potentially you can do it, you know, endoscopically, and so you avoid incisions. I'm not sure how they're doing it in Turkey. But you know, we use Botox for, you know, several different types of procedures, you know, and that was one of them. I mean, obviously, I've never done that procedure in the past, and we never learned it in training, so it's not something that you know, I'm offering or I'm looking to take on. There's just information to support that.
Oh, okay.
Wow.
Interesting. So I have it's a couple of part question for you. Could you describe for us the similarities and the differences between GLP-1 medications and bariatric surgeries? And also, Brandy touched on this, where we speak with a lot of members that say their food noise and appetite comes back after a bariatric surgery. And can you explain why would that happen? And also, do you combine surgery with GLP-1 in your practice as well?
Yeah, I do combine the treatment, and I think you should always offer, you know, an intervention that actually works. If you know, if your patient, you know, requires it from it. In terms of the differences, obviously, you know, surgery is more invasive. It's an operation. You know, medications are a lot less invasive, so the risk is a lot lower. We know these medications to be very safe, you know, from the data that we have. The risk of, you know, severe complications like pancreatitis or hypoglycemia, very low sugar. Low. With surgery, it's more invasive, but surgery is more effective, like I discussed. With the GLP-1s, typically, you know, when you look at the data on Wegovy and things like semaglutide, it's about 15 to 17% total body weight loss at over a year. And with weight loss surgery, it's more 20 to 30%. But with Mounjaro, I mean, some patients are losing 25% of their total body weight, 30%. So I think eventually I'll reach a point where I won't have this job anymore. and because these medications are getting so damn effective, which is great. You from a surgeon standpoint, it makes
You'll
me
be ready
sad.
to retire by then, and you'll be sitting fat. It'll be fine.
Yeah. I mean,
Right.
You'll just
Ready
be
to
on
go.
podcasts,
that's
living
right.
in Italy, whatever, you know.
Yeah, I mean, which, you know, some of the studies, like I said, on Mounjaro and, you know, Triple G, these medications that haven't come out and are still in phase 2, they're very effective medications. And so we're very excited, you know, as obesity practitioners, to be, you know, with the potential of offering these medications. But, you know, for now, the medications that we do have are not as effective as weight loss surgery.
Yeah.
The similar So weight loss surgery causes hormonal changes. So bariatric surgery is also known as weight loss surgery, is also known as metabolic surgery. And the reason is because it induces metabolic changes. It causes hormonal changes. And one of the primary reasons it's so effective is because of the hormonal changes that it induces. So it decreases certain hormones that induce hunger. So it decreases a hormone called ghrelin. Ghrelin hormone that is in the upper outer part of the stomach, and that's the part of the stomach that's removed during a sleep. So when this hunger hormone, patients feel less hungry. Satiety hormones are increased, so patients feel more full. And actually, if you look at the data in GLP-1 levels after weight loss surgery, they actually increase. So it's like taking GLP-1s. So after weight loss surgery, like the sleeve or the gastric bypass, the levels of GLP-1 increases. So it works in a similar way, but obviously, GLP-1 agonists just focus on the GLP, whereas weight loss surgery, you're hitting the GLP-1, you're hitting the ghrelin, you're hitting the leptin. You're improving the efficiency of insulin and the sensitivity of insulin. So it works in different ways. And like the triple Gs, they're targeting 3 receptors rather than 1. So I imagine they'll be more effective.
So how does like regain and the food noise come back if the ghrelin and the external hormones are somewhat removed?
That's a very, very good question, and that's a question that practitioners don't really have an answer to, and it's hard to know. But what I imagine is over time, the effects, these hormonal effects, disappear, or they decrease, and these hormones kind of start to rear their ugly heads, right? So you start getting that hunger again, and you get that food noise. Oh, let me have a little, another piece, or you start getting the cravings, and so. Is that over time these hormones that are being affected recur, and you get increasing levels over time. I mean, from our data, weight loss surgery has very, very good long-term outcomes. At about years, the majority of patients are able to keep their weight off, but there are a significant number of patients that can regain weight. In some studies, it can be up to 30%. It really depends on how you define weight regain. It differently, whether it's an increase in 50% of your lost weight, or once you reach a BMI above 30. So in all these different studies, they define weight regain differently. So it's hard to get a concrete idea of what the rate regain is, but in general, the vast majority of patients who have weight loss surgery tend to keep the weight off. Although you start to regain some of the weight, like Brandy had mentioned, after a couple years. Sometimes it's a little earlier, but usually it's around 2 years after surgery. The max benefit from surgery is within the first 2 years.
Okay, interesting. And adding on to that, so do any neurological, of course, we touched on hormonal as well, changes occur both when your body gains or loses weight? Yeah. And could you describe that for us?
Yeah, I'm sure the other physicians on the podcast have discussed the fact that obesity is a chronic inflammatory disease. So obesity is really a unique condition or a unique disease because it affects every single part of your body, and none of diseases do this. Obesity affects every organ system from your head down to your toe, whether it's causing headaches, increasing your risk of things like Alzheimer's, causing cardiac effects. It affects the endocrine system. It affects the renal system, your kidneys. It affects, your joints. So essentially, it's a condition that affects everything, absolutely everything. So it's a chronic inflammatory disorder. And when you have chronic inflammation in the brain, you get things like cognitive impairment. Like I said, it increases your risk of Alzheimer's. It can increase your risk of depression, obviously psychiatric disease. So it's really a disease that is pretty it's all encompassing and pretty devastating to the body, especially if it progresses to the point where your BMI is in the severe obesity category, and now you have a BMI of 40 and above. And it also increases your risk of mortality. If you look at a graph of mortality, which is the risk of death, if you graph the risk of death against weight, the graph looks like this. And actually, it's pretty flat. And once your BMI reaches 40, it curves. And so your risk of death increases as your weight increases, because it's a condition that affects every part of your body, from your heart to your lungs to your kidneys, to your bones, and obviously your brain.
Wow.
Nobody has ever said, and we've had all the doctors on
All
the line,
encompassing.
has ever
Mhm.
said one that it's all encompassing, and no one's ever called it like a chronic inflammation issue.
Yeah.
It's a
Like nobody's ever said it. We always talk about inflammation, but we don't talk about like that core of it. Like,
yeah,
and we all for sure,
I know that.
yeah.
like I would take this forever just to keep the inflammation away, like,
Ab-
and not
absolutely.
hurt my organs, like trying to process friggin' whatever anti-inflammatories, NSAIDs, you know?
Absolutely. And inflammation, it's important to remember that inflammation is the source of a lot of cancers, and so
Uh-huh.
obesity
Uh-huh.
is a significant risk factor for many cancers. And so when we're able to manage obesity and improve and reverse obesity, we can decrease the risk of many cancers, and which is amazing. So
It
Wow.
blows my mind that it's still considered, with all of this, all these facts and all of this data, they can come and say it's cosmetic. That an insurance company can say it's cosmetic.
Unbelievable.
It's
Yeah.
unbelievable to me, and it
Unbelievable.
makes me angry.
Yeah.
Yeah. Anyway,
It's an
sorry.
equal opportunity inflammatory disorder. Yeah. Disease.
Cat.
Equal opportunity. Yes. Everywhere.
Yeah.
and I think you also asked about, I think you were asking whether I offer GLP-1 agonist, and I think it's incredibly important to have all the treatments in your armamentarium. So as a weight loss surgeon and specialist, I don't want to only offer weight loss surgery, because there are patients who fail weight loss surgery. So like, a third of patients can regain the weight, and then at that point, what do you say? Oh, sorry, it didn't work. Diet and exercise, and
Mm.
you have to be able to offer these treatments that are very effective. Things like GLP-1 agonists, and we used to use other medications. So in my practice, we used phentermine and Topamax, and I hate those medications. I hate phentermine. I mean, it works for some patients, but I'm brutally honest with my patients. I tell them this is a medication that is not the healthiest. It's going to increase your heart rate. It's going to increase your blood pressure. It's going to make you feel like you're wired. And ultimately, what's going to happen is you're going to lose about 15, 20 pounds, and you'll regain it. But patients are very desperate, because, like, Brandy mentioned, like you mentioned, Kim, this is a very, very difficult disease to treat, and it really consumes you. And a lot of times patients feel hopeless. By the time they're seeing me, they've tried every diet under the sun, and nothing has worked. So patients are very desperate for treatment that works, and it's amazing that we can offer these GLP-1 agonists that actually work and that are safe. The risk of complications, side effects with these medications are extremely low, like I mentioned. Obviously, the things like GI side effects, like the nausea and constipation, are a real issue. But these are things, and things that patients will much rather have, much prefer to deal with, rather than the obesity, that's really destroying their lives, and really destroying the quality of their lives.
Agreed.
Wow.
Everyone deserves
Quality.
to have
The
a quality
quality.
of life, right?
Yeah.
Yeah.
And that's just like what Brandy was saying. Remember, she was like, I was about to control delete, like, because you get to a place where you're like, am I even living?
Yeah.
And then that's when you usually make a decision like this,
Well, and the one thing, like, I love about the GLP-1 medication, because after surgery, and still, I mean, I have to be cognizant of getting in my fluids and getting in my protein. But after weight loss surgery, I had alarms on my phone to make sure, have you drank this many ounces of water?
Oh, yeah.
Have you had this vitamin? I was a slave to food and water still again. And now I'm just, did I get in there right? I know how much protein I need to eat. I've been doing this. I'm a pro. I know how many of these I need to drink. And it's more of just, I get to go on with my day and live like the other people live.
Like the normies. I call them the normies. Yeah.
The normies.
Yeah.
Oh, sorry. Sorry. Go ahead.
Yeah. I'm so grateful for doctors like Dr. Rona. I'm telling you, if I'd have found you, I may not have gone to Mexico. I might have
Maybe not.
through the process.
Just
Because he has empathy. He has empathy and he cares.
Yes.
There's other weight loss surgeons, they are not like him. And
No,
your patients
they're not allowed
are
on this show.
so incredibly lucky.
They're
Your
not.
patients are so lucky. And I am grateful for you. And I think that you are amazing. And thank you
Thank you.
from me. Thank you from me.
I appreciate that, Brandy. And those are very, very kind words, and I appreciate that. And it's, like I said, it's an honor for me to be able to help patients. I think one really important thing that I do want to kind of clarify is I don't want to glorify GLP-1 agonists. And this is really important. I think it's amazing that you're having great outcomes with GLP-1 agonists, but there are a not insignificant number of patients who don't have good outcomes, and they're on social media. You see, I lost 70 pounds in 3 months. I lost this much weight in 2 months, and they feel terrible about themselves because they see everyone, having such great. Important to note that in the studies of semaglutide, which is Wegovy, there was 15% of patients who did not even have a 5% total body weight loss. And so some patients are just in that category, and there are other factors in play, whether that's thyroid disease or PCOS or whatever it is. And so it's important to understand that and not feel like a failure, and not understand that not everyone is losing a ton of weight on this medication, and some patients are having side effects, and some patients aren't losing weight, and that's not your fault. You may just maybe a non-responder, and some people are non-responders to surgery. Some people are non-responders to GLP-1 agonists. So don't
Thank you for
feel
saying that. We have so many friends.
Thank you.
So many friends in our community that are like that. And they'll look, I'm one of them. I have friends who've been doing this the same amount of time that I have, and they've lost 150 pounds, and I've lost 80, and I bounce back. I have a lot of set points. I've been at this a minute, and but we have so many. I have one friend's like, hey, like it's been 20 and I've been at this a year. There are so many things like that, and I totally agree. Like the social media piece, that's one thing that JT and I really try to do on our lives is we go, and when someone's a non-responder, we say, hey, it's not your fault. You may just not be one. Or, hey, maybe a different one. Maybe the Manjaro was right for you. Maybe there are other options or other options. And I don't think people realize that all the time. So thank you for saying that, because we try to iterate that. And it is often, I think, muted in social. So I appreciate you taking the opportunity to do that, because there's also people who do get very sick from it, like who cannot take any of the side effects, or who do get gastroparesis. And when it comes to that, because we really haven't talked about that on the show, like, how much do you know about that? Because we haven't talked about it, and it is off book. So if you don't know, I just delete it.
Sorry.
Gastroparesis or gastroparalysis, or however they say it. That's something that sometimes people have, right? It's not all fun and games all the time, right? Some people have struggles.
So gastroparesis, first of all, is a rare gastroparesis to the point where patients are symptomatic from GLP-1 agonist is rare. So typically these medications cause gastroparesis. Gastroparesis, by definition, is essentially poor contraction of the stomach. The function of your stomach is essentially to move food, to basically crush food and move it through into your intestine. And when you're gastroparetic, your stomach is like a floppy balloon. It just doesn't squeeze the food as well, and that food tends to hang out in your stomach. This medication, GLP-1 agonist, it causes gastroparesis. It slows down gastric emptying, and that's normal. That's why some patients may feel a little bloating, and some patients may feel a little nausea. What they think is acid reflux is food that essentially hanging out in the stomach longer than it's supposed to. Sometimes gastroparesis can be severe, and this is very rare, less than 1% of the time. Severe to the point where patients are having nausea, vomiting, severe abdominal cramping, and these are patients who shouldn't continue the medications. But most patients have very mild symptoms, and those symptoms usually tend to go away. It's present in the first couple of weeks, or when you increase your dose, and then they tend to go away.
Yeah.
But
what about go ahead.
It's important to understand that gastroparesis is a normal effect of the medication. It slows down gastric emptying.
So when people get off the medication and they still have it, they still are having this paralysis, if you will. What is that? That's, from what I understand, that is also very rare, right?
So technically, when you take the stimulus away, the gastroparesis should go away, right?
Okay.
But in some patients, I mean, I read that, on I think it was on some news or some article, that some patients were having gastroparesis despite not being on the medication or discontinuing the medication. I think patients, they probably already had an underlying predisposition to having gastroparesis. Diabetics exposed to having gastroparesis. So a lot of patients who are on this medication are also diabetics, right? And so they
Yes.
may already have gastroparesis, and now this medication kind of put them over the edge. And now they have severe symptomatic gastroparesis despite not taking the medication. So that's something that if a patient does suffer from that, it's important to see a GI doctor. There's a study called the gastric emptying study that measures the amount of time it takes for the stomach to empty. And if that test is positive, then there's medications patients can take for gastroparesis.
That's awesome.
Oh,
Thank you so much for clarifying that. There's not, hey, want to make
yeah.
a talk. If you want to make a TikTok because you've been a little behind, like you said, that's the one to do it on.
Yeah.
You're welcome. You're welcome.
And we will share it.
Tag me. We'll blow it the hell up.
We'll blow it up.
That regardless of what intervention you choose, whether that's medications, endoscopic interventions, surgery, the basis of any weight loss endeavor is eating healthy and exercising. With that being said, the chances of reaching a healthy weight with just diet and exercise, if you have severe obesity, is less than 1 in 100. And as your weight increases, that chance decreases to less than 1 in 1,000. So it's incredibly low. And the reason is because your biology works against you. And people don't understand that, or didn't understand that in the past. It's diet and exercise is so ineffective is because our biology. And so a lot of obesity, about 60% of it is genetic. And a huge percentage of it is a metabolic dysregulation, a hormonal dysregulation that you don't have any control over. And it's beyond, the environmental effects. Obviously, the environment affects your weight, right? So if you're eating unhealthy and binge eating, you'll gain weight. But your chances of reaching a healthy weight with just diet and exercise is extremely, extremely low. And that's why bariatric surgery exists. Because the majority of patients, the vast majority, over 99% of patients who try to lose weight or reach a healthy weight with just diet and exercise fail.
Yeah.
I totally get that.
Yeah.
I've been
Yeah.
sporty, athletic, fitness all my life, and I was also a binger. But every time I would gain, I could maybe white knuckle 30 pounds off, but it'd come right back. So
Mine's always, that's my number
totally
2.
understand.
30.
30.
And sometimes, because you'll watch these shows like, The Biggest Loser, where patients lose 100 pounds, 150 pounds. And it's like, wow, I mean, this person did it with just diet and exercise. But there was a study that was published in the New York Times that looked at the contestants who were on The Biggest Loser and followed them for 6 years after they lost all the weight. And every single one of them regained the weight. And a lot actually heavier than they were before they started the competition. So this is a problem with the hypothalamus, the control center in the brain, which controls. It's the primary weight regulator, and regardless of how much you exercise and you diet, you can't change what's set in there. There's this idea of a set weight theory, which you guys might have heard before, but
We heard a lot.
the idea, you have a preset weight, and your body tries to keep you at that weight, and so it's very, very difficult, and it's it's a struggle for patients because you take the onus, and you blame yourself, because the idea is, if I eat healthy and I exercise, I should be able to lose the weight and reach a healthy weight, but that's not the case, and we see it so many times. I see it every single day. I mean, I had a patient who was in my office yesterday, a young woman who was sobbing. She was in tears because her 8-year-old son refuses to hold her hand when she drops him off at school, because all the kids make fun of him because his mom is overweight, and she was just in tears. And it was so heartbreaking for me because it's what do you say to that person, when your child doesn't want to hold your hands because of something you can't control. So it's just, I see it every single day, and I'm glad that we have medications like Wegovy and GLP-1 agonists, and we have weight loss surgery that works incredibly well. So So it's nice to be able to offer patients solutions, but it's also important to know that this is like we keep saying, this is a chronic disease. So there is a chance you'll gain some weight. There's a chance that you may regain all your weight, and that's not always your failure. Sometimes there are some things that you did to contribute to that, but not always. So it's important to be able to talk about that with your physician or whoever's managing your obesity. And I think it's also important to say that there are a lot of physicians who, can I curse on this?
Oh yeah, let's do it.
Oh yeah.
Of course.
There
Let it
are a lot of
fly.
physicians who don't know shit about obesity.
A lot.
I would argue that not most, but a significant percentage of physicians
Yes.
don't know shit about obesity. They
I'd
don't
say
know what.
most.
Yeah, I'm
I would
with
agree.
you. They don't know. They haven't accepted that it's a chronic disease. They're not willing to manage it. They're not willing to refer a patient to someone who can manage it, and they just refuse to see the reality. And so it's important, if you feel like you're not being heard, or you feel like you're not getting that you need, see someone else. There are so many physicians out there. And find someone that you trust, that is out to for your benefit, and someone that can help you reach your goal. I always tell my patients, before they have surgery, that this is not like a one-stop shop. I do the operation and you figure it out, and you lose all the weight magically.
Yeah.
This is a long process. I'm going to be on this journey with you, and I'm going to be on this journey the entire time with you. And it's going to be hard. We're going to struggle, but we'll get through it. And if you need me, I will always be there to help you through the process. And so you need a physician that will be there for you. And there are a ton. I mean, I see them all the time on TikTok. You've had them on your show, and so just definitely find someone who listens to you, because some physicians will not, and they'll just tell you to diet and exercise, and the chances that you'll reach a healthy weight with that are slim to none, unfortunately.
Yeah.
But like I see Brandy, because she and I have had very similar, right? And like, is it like killing you to hold back? Because like it is the validation of hearing someone say those things is huge for people like us, and for people that are listening and hearing that we need to hear those things mixed with these stories. And we need to know, because like I'm still healing, like I'm still healing here, right?
Yeah.
Regardless of the fact that my body is getting in a better place. And my doctor called me relatively healthy the other day, and I was like, stop it. Like I was like, I'll take it any day, and things like that. Like we're still doing so much healing up here, and forgiving of ourselves. And it's like you said, there are things that you do that contribute to the weight stuff, but why'd you do them to begin with? Right? Why was that happening? And so I think it's really nice to hear you say these things. And there will be a lot of shorts of this episode.
I will
will
is
tell
like
you.
gems.
I will tell you, I have wanted to start a traveling business where I go with my friends to their doctors and be like, and I talk for them and be like, oh no.
It's called an advocate. You can do that.
Patient advocate.
It's a thing.
I do want to be an obesity advocate, because
Again.
here, I just have to tell this story really quick, because it's absolutely appalling to me. So I don't know if you saw my TikTok about my friend who went to the doctor. She was on board with giving her Wegovy, which her insurance pays for. Okay.
Mm-hmm.
She said, let's do blood work. Amen. Obviously, baseline.
Sure.
Let's see where you are. That's a smart doctor. Comes back to review her labs, and the doctor goes, you do have high blood pressure, so we are going to want to put you on a blood pressure medication. But I think I'm just going to ask you to work out and eat a little bit better and see where it goes from there. Livid. Like I lose it with this friend. I'm like, no, you're not. Woman is new to this practice. This practice just announced, good news. Said doctor is now offering Botox.
Oh Lord.
What?
So my wrinkles need to be taken care of, but my chronic obesity Does not. And don't get me wrong.
I need
Girl,
both.
you go get your Botox. Girl, you go get your Botox. You get your filler. I'm for it. I'm for all the things. Because I mean, I went and got implants. All right. Like I got everything.
We're team all the
Listen,
things.
like I am 100% on board with tweaking it all.
Yeah.
But for you to advocate for looking better but not being healthier is like,
I feel like that's like Brandy, like what that screams to me, and I would love to know what Dr. Rona thinks, is that doctor does not want to deal with PAs. That doctor does not want to have to deal with the back and forth of dealing with the insurance company, regardless if it's covered or not, because they know it's going to be a giant pain in the ass and take a lot of time. That's what I hear. Because Botox people are paying cash, you know?
Oh, yes, indeed. Yes, indeed. I see. Yeah.
Yeah.
I mean, obviously, insurance coverage is a significant obstacle.
Yes.
A lot of doctors are just unfamiliar and uncomfortable and using these medications they haven't used before. But I mean, for a primary care doctor, I mean, Ozempic is a fairly common medication that's used for obesity,
Sure.
and this is similar. So I mean, I I think it's wrong to deprive a patient of a treatment that can actually work and help them. But at the same time, it's wrong to do something you're uncomfortable with. But refer the patient to someone.
Refer them.
thank you.
Just
Thank you.
refer.
Because that's the thing that
it.
blew my mind. I'm going to give you this pill for your high blood pressure, which losing weight is probably your obesity is probably the cause of her high blood pressure. I'm just going to go. I'm no doctor, but
It's
it's
because math. It's girl math.
I could not. I literally wanted to drive to the practice and be like, I need her to come out here. I want her to explain to me. So we don't even have to talk patient. Like, I know because HIPAA, but like, explain to me.
You wanted her to meet you in the parking lot. That's
Girl,
that right there. That's the Scorpio right there. Right there. That's
It
there,
is.
Brandy.
It is.
All that
It is.
sweet stuff you saw, all that
I
precious
am
stuff. That's all they have.
feral.
This is
I am feral when it comes to this because, like, I don't think, and this woman is naturally thin and she's beautiful. She really is. And so I think that's part of it too. Like, if you've never been in my shoes, you've never walked in my shoes, you've never walked. How do you understand? But at some point you got to get on my level. Like, get on my level. You're a doctor. Yes, you're smart. I think you're incredible, but get on my level or get out of the practice. Go do something. Do your Botox, do your filler.
Refer me to an obesity specialist or an endocrinologist or a bariatric surgeon.
Right.
Like the trifecta. Just give me one of those people because they'll know about my disease and how to treat it. Like, you know, and I
want
think
to speak to the manager.
I want to speak to the manager.
All right,
exactly.
Karen.
Oh, that's what we should call this episode. I want to speak to the manager. I love it. Okay, so Janine, would you like to ask the last question so that we can let Dr. Rona go?
Sure. Look, hey, we have been on a roll. I love it. But Dr. Rona, the last question is our community guest, Brandy, has shared with our audience how important it is to eat well post-bariatric surgery. What are some surprising tools to utilize with nutrition post-op?
And it was also eat enough, wasn't it, Brandy? Weren't you like, you have to, if you're in a bigger body, you need to eat like you're in a bigger body, something like that. It was a good touch.
Right. Maybe he hasn't seen that. And I forgot to touch on that is like, we are so conditioned by diet culture, 1,200 calories or 1,100 calories or something like that. But I mean, when you have bariatric surgery, obviously that is kind of where you start out. But when you're 300 pounds and you're starting on a GLP-1 journey, like you can't cut your calories down to 1,000 calories. And then at some point your body's going to be like, what? I'm starving here. And the brakes get pumped and your body's like, yeah, you're going to start losing weight, but it's going to stall out. And so like, you got to eat, girl. You got to eat the food. You need the calories. My surgeon was like, we want you to get here. Like his was like, I need you to start focusing on getting in your nutrition, and calories are key. You're going to have to eat. And so that's the biggest thing that I preach to my friends, especially when they say this all out. And they're like, well, I'm eating 1,000 calories. I'm like, girl, you weigh 230 pounds. Your body, it's like trying to get 600 miles on a quarter tank of gas in a vehicle that gets 13 miles to the gallon.
Yeah.
Not going to happen. You're not getting there.
And what
I
happens if you do eat 1,000 calories a day and you weigh 300 pounds? What happens there?
So-
Go ahead, tell us.
That's an interesting question, and a lot of times, when I'm seeing patients pre-op, before they've had surgery, many of my patients tell me, whether they weigh 300 pounds, 250 pounds. A lot of my patients eat once a day. They'll tell me, Dr. Rona, I eat one salad a day, and I have a single portion of fruit, and that's all I eat, and I lose no weight. And that I tell them exactly what Brandy just said. I tell them you need to eat more. You need to eat more to actually lose weight, which sounds counterintuitive.
Yes.
What
Yes.
essentially when you're depriving yourself or having this one meal a day is your metabolism is just going down into the gutter. And so despite the fact that you're having such low caloric intake, you're barely burning any calories to help offset that. So time you're not losing much weight at all, and obviously with the predisposition to obesity and the hormonal and metabolic issues that we talked about before, I mean, this patient's not going to lose weight. So a lot of times I tell them, increase your protein intake. You need to make sure you have at least 20 to 25 grams of protein per meal, and you need to eat more. You need to have multiple meals, at least 3 meals a day, and make sure they have enough protein. I generally tell patients to try to avoid the processed carbs. Obviously, I'm not trying to create any food fear or anything like that,
Yeah.
but in general, I tell patients to increase their protein intake, make sure they're not, really restricting themselves, make sure they have a well-balanced diet, and try to avoid things that are obviously, not as good for you, things like soda and sweets and things like that. But it's also important to note that, it's not a one size fits all. Your advice or my advice and my education really needs to be catered to my patients because will respond well to multiple small frequent meals and another won't. And so you really have to see what works for the patient. And sometimes it's just trial and error. It's just kind of finding that right concoction that works for them. And every patient is different. And so, it's just important to have patience and have an open mind.
Yeah. That's awesome. Man, that was a good way to finish things out. Well done.
Woo.
Well done.
So
Anyway, this has been great.
thank you guys for having me. Dr.
Thank you,
Rona,
Brandy.
it was incredibly honoring to meet you. And again, your patients are very lucky to have you. I
Agreed.
thank you
Yeah,
for validating. Thank you so much for validating them, for giving them courage, for telling them you're not alone. I'm here. I'm going on this journey with you. That got me.
Me too.
Because
Me too.
sorry, I'm so sorry.
No, it's okay. That's what Brandy,
Yeah.
that's what we do here. We talk
So
about it and we
many of
heal.
us feel so alone. And this right here has been a life-changing, not even just the medication or my surgery or anything, but finding these people, finding my people, finding providers that don't look at me and tell me that I'm crazy, finding a provider that will validate and say, I'm taking this journey with you is, feels so good to hear that. And so thank you.
Absolutely.
Thank you so much.
It's an honor
Thank
for
you.
having all
Thank
you.
you. I know she kills me. I know.
I know.
like this.
Gosh,
I'm such a ball baby.
Well, I love it. I love it. Well, thank you guys so much. I want to make sure I honor your
thank
time.
you.
I will exit you stage left. But thank you so much.
Thank you. This
And
was so
go enjoy
exciting.
your evenings. And thank you both for your contributions to our movement.
Bye.
Oh my
Yay!
gosh. I
We had
felt
magic.
myself tearing up.
Oh, it's really hard to get you there. I'm like a big ball baby, but you take.
Yeah,
But once you're there, you're like,
I have never
Go in the
heard,
middle.
and I think that we
Yeah.
said this collectively, I've never heard obesity explained the way that he explained it.
chronic inflammatory disease.
Yeah. And
And
now it
inflammation
makes
creates
sense.
all the problems in the land.
Yes.
Does it?
Because remember, we've had so many people in the community, including ourselves, that have said the inflammation, and especially like when you first start Mounjaro, And remember, I even said it. I like touched my thigh
I remember
one
that.
evening, and I said, I feel like I'm deflating.
Yep.
And
I remember when
thought I
you
was
called me on the
crazy.
phone. Yeah. You called me on the phone about like in that time frame, about when you had that experience. And I answered FaceTime and you went like this because my face looked so different because I had been on Manjaro for a few weeks. And it just was like
Mhm.
all that
I was gonna
inflammation
say,
that I had.
your face is like really shrinking, Kim. Like it's like
Oh,
Yep,
is it?
it sure is.
I'm using a new neck cream. Could that be what it is?
I need one. I
No,
need an
it's
eye
not.
cream. I don't think this coconut oil is kicking it
Mm.
anymore. But anyway,
Well, you know, tangent. That's what Kat always says. Tangent.
remix, the remix.
Remix. I love it.
Yeah,
Yeah.
That's Kim.
Okay.
I know. I told her the same thing, Kat.
The
I
jaw.
was like, yo, you can see.
And also your shoulders are like.
This is a size large, Cat. It's a size large.
You're official now.
Mhm.
I know.
Well,
When I got
I would
into
say
a large, I was
I'm
like,
like an extra large mostly, you know. But this is
Look, look.
I
No
mostly
more.
get
we can
larges
pretend.
now.
We can play pretend. Well, no, like I got a t-shirt and it was an extra large fit, but I wondered when I put it on, I was like, oh God, I don't know. An extra large? Like, I feel like I'm more like a 1X. Did you know there's a difference between a 1X and extra large? I didn't. You want to know why? Because I've always been a 1X. That's like at least bare minimum. Yeah. Crazy. Anyway,
Absolutely.
I digress. Thank you, ladies, for noticing my jawline. I appreciate that because I have like all the crepe papery stuff, and that's not fun. I am trying that new cream though that's all viral on the TikTokery, and I'm measuring it. I started. I was like, here's me with nothing on. I'm gonna put on the cream. I'm pretty sure it's total crap. I think it's crap. There are just some things I think are just what they are. And I think that when you lose a lot of weight,
that work.
but JT, they're not gonna magically make your crepe paper skin go away when you lose 100 pounds. Like it's just it's gonna be there. Like
I mean,
it will change.
Look,
Possibly.
because remember when I first started, I was so self-conscious about my neck, and I started using Strivectin. Let me tell you something. Even one of my fellow coworkers said, "Your neck looks really good." I said,
"That's." You're like, stop it.
Look,
that's hot.
Look, huh? Really?
Stop.
Look, yeah. But I think that eventually all of us will just be slathered in some type of cream, lotion, or oil.
Speaking of oil, I wish I could link this in my TikTok shop.
The castor oil. They were talking about that today.
That stuff.
Castor oil. Cat,
it works though, Cat.
Cat,
does.
I'm just
Castor
gonna
oil
say
is
it
a
to Jesus
laxative
right
to me.
now. I poop like it. I don't eat it. I put it on my skin. I poop like a champ. And now I can eat more calories because I poop more often, which means I can lose more weight, which I can be because I was too constipated all the gosh darn time. Castor oil.
Do you see how passionate she is about this?
This one.
How passionate she is.
Jamaican. This is what it's been a year, you guys. I only poop like every 4 days now. I poop every day.
Oh no.
Castor oil. Commercial. Yeah, babe. It's been every 4th day.
Oh no, man.
Now I go every day with castor oil.
Oh my!
It is life changing. Oh my God!
Every day with castor oil.
In case we didn't think about it.
Talk about this,
but it works though.
Commercial.
It does.
But it does
I don't
work
eat
though. Seriously.
How?
Seriously.
It's crazy. It does. It's not just me. Like I posted it and everyone in the community is like, oh yeah, hell, I've been taking that for years. I'm like, what? How do I tell me this 14 months ago? Now I'm pooping like a champ. What if we go to
I have that issue? Maybe a little bit, but I just ate extra kale, nuts.
No, I like kale, but I would not eat extra kale.
I do eat kale. I still eat
Or
the
just
yellow
extra
dragon
greens, spinach.
You still eat the yellow
greens.
dragon fruits? Yeah. I was doing
I had a yellow,
all the other normal things, you know?
I had a yellow kiwi. Does kiwi make you kind of regular?
Kiwi is good because
I love kiwis.
I
get the yellow one.
My doctor.
Yeah. And I don't take the skin off. I eat the skin because not hairy.
Yes, but if you can eat the skin, that's even better. But according to my doctor, she always said
gross.
With
fiber. The yellow is not furry. It's not furry. The yellow is not furry. Yeah.
But the green is furry. But
I got cut off
to help get your fiber in. apples, pears, or kiwis, and yellow dragon fruit. She said those 4 fruits will help.
It's been like a mind shift for me though, where I've been like, oh my God, I'm eating so much food. And then I look and I'm like, no, that's just like, it's twice as much as you were eating because you weren't eating hardly anything, which we've just talked about is it helps you lose weight if you eat. Like you have to fuel, right? And like, I'm just excited. And you want to know why I'm excited? Because Jamaican black castor oil.
And it's making you do what, Kim?
Poop like a champ.
Cat, she's like, oh God.
This is what they're going to play when we win the award, the Cheers Choice Award or any award
like a champ.
on stage. Remember that time? It was like a poop. I don't care. I do like a champ, but I'm stoked about it. I feel like such a winner. Even advocates and GLP-1 evangelists need an opportunity to step away from things and live our lives. So there are going to be times where JT's not going to be here, where Kat's not going to be here, and even I'm not going to be here because we have to be able to have time to live our lives. We fight all the time, but we need a minute sometimes, right? Because that's what keeps us going. We need to get refueled, Anyway, hey guys, we should probably end the show now.
We should.
And for all of you diehards that are still here, we love you the most.
Heck yeah.
Look, just so you know.
Love you.
We love everybody, but we love you the most. If your name is Tay, you're one of them.
Heck
Sabrina. Let's do shout outs. Sabrina and Shell, and of course, Lydia. We love you the most. No one's watching with them. Okay. Hey, let's end it. Do you guys have NSVs or are we just going to go and go to bed? Because I'm tired. That was a good one.
I have an NSV.
What is it?
I can, my trainer had to call me out on it. I didn't realize, I posted this on my TikTok, but she said, why can't you point your toe and put it in through the loop? Because I'm so used to being big and I always had like girth right here. I would over bend and compensate and stuff. Yeah. But I was like, oh, wait a minute. I had problems at first, but I can do it. My trainer called me out on it. She's like, you got to start. She told me I have to start working more on balance because I don't have mass here anymore. So I call it an NSV.
I think that's a great NSV. I love when that
believe
happens.
that is an NSV. Heck
yeah, me too.
Look,
like I remember when I first could take a shower. I remember when I first took a shower.
Hell yeah!
You know what? And did you guys hear Kim's dog's claws in the background?
Could you hear? That was Kratos. I remember looking at him when I was making it, and I go, "Shut up."
It was I expect to hear dog noises behind in your background all the time.
I know.
It's not a fun
also here's my pug.
If there's no dogs.
No. Like I'll be sending her a message and my pug is next to me going, and she's like, I'm like, sorry, that's the pug. And then I just keep talking like nothing's there. It just cracks her up.
You're used to it. Hell yeah.
Hell yeah. Hell yeah, it is. Hell yeah.
Use that sound. I want to use it again.
Hallelujah.
Go use that sound.
Go use that sound. It's going viral. Let's keep having it go viral.
Yeah. Anyway, NSVs.
Right,
Anybody else? NSVs?
I don't have any more today. I just got miniature large. I'm feeling good about that. So those are NSVs for the week.
Yeah.
Yeah.
That's it.
Huzzah, huzzah.
Yeah.
Hell yeah. So we will see you next week.
Next time.
Pasta. Interested in understanding GLP-1 medications like Ozempic, Wegovy, or Mounjaro? Then join us on the Plus Sides, Cracking the Obesity Code, the groundbreaking podcast helping people change their lives one episode at a time. The Plus Sides podcast is a disruptor. We're breaking down barriers, smashing stereotypes, and sharing inspiring stories that'll leave you feeling informed and empowered. Join us every week to learn from doctors who are specialists around GLP-1 medications like Ozempic, Wegovy, or Mounjaro. They'll provide you with science and facts to validate these incredible stories. But that's not all. We'll also bring you the voices of the GLP-1 Mounjaro TikTok community, real people who face the challenges of obesity-related diseases and disorders and discovered the incredible plus sides of GLP-1 medications. Our episodes are filled with heartwarming stories, laughter, and moments of triumph. You'll connect with our amazing community members who are reclaiming their health and experiencing their fullest lives. Are you ready to embark embark on a journey of discovery and empowerment? Tune in to the Plus Sides Cracking the Obesity Code, and together we'll change the narrative around obesity and end the stigma. Subscribe now on YouTube or your favorite podcast platform and join our incredible community. Let's celebrate the plus sides of life together, because every story deserves to be heard. Every life deserves to shine, and everyone deserves access to expert knowledge and medication. The Plus Sides Podcast. You're not alone. It's not your fault.